Thank you for coming to Turkey. You are coming from Kenya, right?
Yes, yeah.
Normally you are Somali.
I'm a Somali, but I also live in Kenya.
Kenya, and so, you were born in Kenya?
I'm born in Kenya.
Yeah, for a long time you are living in Kenya.
Yes.
So, how did you notice that you have a varicocele disease?
Actually, the way I started noticing was, you know, I was unable to impregnate my partner for quite some time.
Yeah.
So I started worrying, what is the issue?
Yeah.
So I went to the hospital, fertility hospitals in my local area, and then they did sperm analysis, and then they did also hormonal analysis. So there was certain imbalance in the hormone. Yeah. At the same time, there was also decrease in my hormone production hormones. Yes. Yeah, particularly the ones responsible or supporting sperm production. So they were very slow. They were very decreasing. Actually, they were decreasing after every year. Whenever I start to do sperm analysis, it is continuing to decrease. So the decline is what made now me to do also a scrotum test to understand what is the problem. Yeah. So the tests were okay. They were saying, but there was varicocele grade 2, grade 3, yes, depending on different hospitals.
Yes, actually it is for me grade 2.
Yes, for me grade 2.
But it is very abundant.
Okay.
Yeah, it is the veins are not too big, but it is like a radiator. It covered the testis in very abundant way.
Yes.
So this is a grade 2, but too many veins.
Yeah. So that's how I started noticing, and then I was a bit hesitant to do the surgery in my place.
Why?
Because
why some people hesitate and find
this is an important machine for me.
Yes.
Yeah,
yes.
It's an important machine. So sometimes you can go to.
So before you don't know anything about our surgery, about me, but you start.
I started Google search.
Yes.
I started to Google search to understand what varicocele is, to know what is actually the cause. Actually also to understand what will be the post-operative.
Some people love to make investigation, some don't. They believe in what is said and they go. It is also true, it is also some way, but some people love to investigate, and you were knowing everything I said before you come. Very interesting, yes.
So I started studying myself what varicocele is. Yes. So I went to Nairobi the last time. I went to Nairobi, and then I started decided to do it, the surgery in anywhere, but before I do it, then I should first try IVF. Yes. So that in case of anything, then I have another baby. I already have children. I have children, but I just wanted to have more children because we Somalis, we believe that we need that to have more children is a blessing. Yes. So in Nairobi, they did also a sperm test. I did in 2 different places, and then they were actually, the result was the same. Yes. The findings were the same, and then they both confirmed that I have varicocele. Yes. But another thing that was confirmed was that there was a blockage in my sperm channels. Yes. So the vas difference, particularly. Yes, the vas difference. That's where they say there is a blockage. So. I started now again asking myself, what is this?
You start investigation.
Yes. But from now reading, I read a lot of literature materials on the sperm production and how it happens. So the blockage was something that was not evidently clear because the sperm production is there, the sperm is coming into, but it is less. Yes, it is. So I ruled out the issue of blockage.
If there is blockage, really the sperm decreases too much. And their volume decreases and sperm count decreases. Sometimes zero sperm count comes out.
So I did not have a zero sperm count. I had a sperm, but the count was less. So in between, while I was doing all those medical examinations in Somalia, in Kenya, I came across your.
Yes, and you notice that we are doing something different.
Yes, from the other doctors.
We deliver the testis, we see these veins clearly. And normally in our plastic procedure, in every doctor is educated, you have to ligate this part and this part cut in between, it's okay. And you will leave these veins to disappear by time. So I was doing it this way, but then I also use Doppler ultrasonography before the operation, after the operation, too much. So, like a radiology doctor. So, when I look to my patients after the procedure, I noticed that these veins are still there. I said, oh, it's impossible, but then I think, okay, why not? Because we ligated, this vein will disappear by time. So, we start follow-up, and in follow-ups, I noticed that they are not disappearing in some of the patients. In 3 months, maybe 30%, 6 months, 50%, and at 1 year, it is 70% disappear, but 30% stays there forever. And people do Doppler again, and they say, oh, it recurred again. No, it is not recurred. It is persistent varicocele. It was there all after the procedure. It didn't disappear. So I decided what to do. I talked with this vascular surgeons. They said, remove them. We are removing them. Vascular surgeons are removing them. And I said, okay, why not? Now we are removing. So you understand this procedure? You understand that
it was different. Yours was different from the other doctors who are explaining. So for me, to choose the best doctor, then I said, one, he must be an experienced. He must be doing different. And then the recurrence level is also 0. Because most
actually it is still 3%, but your case is not extreme. In extreme varicoceles, the best ones, I take out this long veins, they are prone to recur. Your case is a moderate one, inshallah it will have no recurrence.
Those are the best factors that are considered now to select where to go now finally.
These are all important, and one of the most important things, experience. Even I do the normal surgery, if you do such number of surgery, you will be experienced. Because normally a urology doctor operates 2 varicoceles in a month. I operate sometimes 20. So it makes a good experience, and I am working with Ali, who is recording now. We always do same team, the same operation, so we get used to it. So when I look to you, look this. This is a small. Okay, we see these vessels, and we deliver the testis. Testis delivery is important. It is not harmful, nothing. So when I see these abnormal radiator-like things on the testicle, I begin to remove it. I dissect it. And inside, I also see in the spermatic port big veins. This is vas deferens, and this is not obstructed, of course, and this is the inner vein. And then the outer vein, this is testis in the outside now. It has many branches. We take all of them, and the testis become naked. It is not harmful, it is not difficult. We do it easily, fastly, quickly. And so we take this out, and this is inner vein. Now the testis is inside, it's not out, and we dissect it this way. So normally, again, dissect it here, ligate and leave it behind, but we don't do it. We dissect, this testis is in now. We dissect and take it out as a long segment. And there was one way next to the artery, but it was not this big. We ligated it in many parts, not only one ligation, ligated from 4, 5, 6 places as needed. And so we are very happy. We usually, if we take out enough veins, we can write the initials of your name.
Some people are saying, what is this letter was removed from your scrotum?
It's really fun. It's our hobby, and you are in the operation. So you didn't sleep. It was a spinal anesthesia. Were you happy with the procedure, with the hospital?
In fact, the procedure was okay. Even after the procedure, I did not feel any pain. I was just as normal as I was before.
The cost issue is important. We have very luxurious hospitals in Turkey and moderate hospitals. This was a moderate hospital, but we are happy with this. We do most of the operations there. And if you are happy, we will continue to do there. What do you say? What's your comment?
Actually, one thing I found out is that, some doctors sometimes, exploit you in different ways. You advised me in the best ways. Actually, money was nothing to you, because the first priority thing for you was my health. And you actually advised me on the financials even, saying me, if you go this will be high, if you go this will be. you advised me to go for the less
we have options.
Which I was really happy, because that also makes me sometimes, you know, as a patient, it contributes to your health as well. It doesn't give you stress, financial stress.
I really have to care. I don't. You have a stress with the disease. You have a stress with the travel. You are having a surgery in another country. So I don't want to have
actually
too much financial stress.
That helps me a lot, because I do not have any stress. You know, money is something big. It gives you a lot of stress. So that was well, you know, catered, and you helped me on the financial, and this is not an expensive procedure.
So it is doable, it is tolerable, it is financially, and coming here from another country, and tomorrow you will go back. So in 1 week everything finished. We did the operation in Sunday, right?
Yes, we did on Saturday. We did Saturday. So you come. I spent the night there. Then on Sunday around 10 a.m. I left the hospital. While I was walking.
Then Monday, Tuesday you rest. Today is Wednesday. And Thursday you will be leaving. So if you come at Friday and you can leave at Thursday, 1 week usually is enough for us. Thank you very much for your all kindness and help. I know many Somalian friends, when they call me, I give your number last week, and you help them. Thank you very much for this too. It's an honor for us to have you here coming for this.
Thank you too.
Thank you for everything.
Thank you too, Doctor.
And now we are finished half of our procedure. The other half, when you get the baby, we will be finished.
Inshallah.
So now we will continue to follow you from distance. I will give you some medications. We have some supplements. I have maybe 3 or 4 different supplements. We use these, and we want to give these at least for 3, maybe 6 months. These are important because they help to increase the sperm number. If even it's a low ratio, we will still want the sperm to raise as quick as possible. So we will continue to follow up. You will, after using these 3 months, you will send us your results, and we will comment. Maybe we will change. Thank you very much for coming. I hope you have a good and beautiful children in the future with higher.
Inshallah.
Thank you.
Inshallah. Thank you too.